Hello, bright minds. So, today on Beyond Sight, we have a very special guest. He was my teacher at Chennai, Sankara Nethralaya, and he was the guy who inspired me not only in practicing uveitis in the right way, but a lot of other extracurricular things in life. He is the guy who is actually the founder of an educational website which is accessed by millions over India and across the world, that is eOphtha. And he did this in an era where YouTube, Instagram, Facebook, and all these educational, so-called educational platforms were not very prominent. So today we have a senior uveitis consultant, Dr. Parthopratim Majumder, in the podcast. Hi sir, welcome to Beyond Sight. Hello. So uvea is it's not a very conventional subject, but I think 15 years back or more, I guess, you had this insight of taking uvea as a field of practice. So what inspired you to become a uveitis specialist?
Yeah, it's a very interesting question, and many people ask me that. So one thing I realized that it is very challenging, and I was brought up by reading all the detective stories, Sherlock Holmes, the Byomkesh Bakshi, Feluda and all. So somehow I feel there is a detective inside us, and all of us, we want to solve the puzzle. So I got attracted to uveitis when I saw my teachers and all, they are also not sure of what they are dealing with. And everyone will comment on that it looks like. And finally you need to solve the puzzle, you have to crack it, and it requires multidisciplinary approach. It requires a lot of history taking. You talk to the patient, try to find out. It's just like the crime detective interrogates the criminals. You have to interrogate, you have to find out the history from your patients. Then with that you have to recognize what is happening inside the eye, and then only you can actually crack the mystery. So I think it's a very interesting to deal the uvea patients in clinic, and it gives you a different kind of dopamine surge.
Correct. So it's the mystery that gives the thrill.
Yeah, exactly. Yes. It's the mystery that actually gives the main.
Lovely. Thank you, sir. Yeah. So the next question for Dr. PMR is, so you have had a journey of 13 to 15 years in the field of uvea now. So if I ask you three important things, three crucial lessons that you have learned out of the last 15 years, what would they be, sir?
The first one will be the power of observation. I think it's most important, the driving force in medicine. And patients are your textbook.
Very true.
Whatever you study, whatever you do, ultimately you have to learn from patients, and you have to understand that each one is difficult and each one is different, and you have to treat it differently. Like the same medication may have different side effects, different results in patients. So I think the power of observation and it will be the first. The second will be, I always keep telling that don't fall in love with your diagnosis, because that's very important to understand that when we diagnose or we make a differential, we will be biased towards some entities. So that we must understand that we have to justify our differential diagnosis based on our clinical.
So not get very overconfident with whatever we are thinking.
Exactly. Whatever you are thinking, always think about that, and always keep your plan B ready. Sure. So whenever you are treating a patient, always think that if this is not working, then what I am going to do. Sure. And the third one is in uvea. I feel it is very important. You need to have a very good friends, multidisciplinary friends. You need to have a very good pulmonologist, you need to have a very rheumatologist. I'm fortunate enough, we have such a great friends like Dr. Gayatri is there in Apollo, will take care of all my pulmonary medicine related queries. We have Dr. Mahesh Janardhan, who will take care of all my pediatric rheumatology. Dr. V.V. Kaushik will send all this rheumatology referrals and all. So you need to have a good team. It's not a one-man show or one-man game.
True. So if I have to sum it up, I think art of observation, I think that is very keen for every doctor. Second is, you have to have a plan B in your head, not fall in love with your diagnosis. That is 2. And 3, as always in uveitis or in life, have great friends. Thank you. But I want to know, there are so many conferences happening today. Every second day I see a brochure with some common names, some uncommon names. As a young guy, because of at least 20, 25, 30 conferences happening in a year, which conferences should I specifically pick up, and what is something which I should aim at?
No, I feel you should be always focused, and you have to see carefully evaluate a meeting program. That is very important. Unfortunately, in our country, the exact program will be ready only after 2-3 days or a week before.
Sure.
But if you want to plan a conference, I think it's always better you ask yourself that what is your primary focus?
Sure.
What you want to learn or you want to deliver. The number 3 is always look for case-based approaches, like the conferences or the meeting where there are challenging case presentations. There is a lot of scope to learn new things, because didactic lectures, we have reached a state where the didactic lectures are overkill. Because you can see that we are living in an era of tsunami of education.
It's everywhere.
Everywhere. There is webinar, there is so many. So didactic lectures, I am telling, still it is a very good format of teaching. But I think the challenging case discussions are very good. Another important point, you should look at how the organizers have planned the meeting. What is the time for discussion?
Correct.
Whether they are allowing you to clear your doubt,
Correct.
whether there are chances of discussion. It may not be you, somebody else is asking questions, and from that you are learning something. So the discussion, I will suggest you attend a conference where there is a case discussion and followed by a significant time is allotted for a case discussion. So these are the meetings actually is very, very much needed. And always try to see that if somebody is experimenting with that new format, new design of the meeting, because I have seen many people, talented people are now organizing nice meeting, and they are coming up with very innovative ideas also.
Correct. So I think because conventional meetings, I feel, have gotten a little monotonous now, because it's the same thing being discussed everywhere. But it is not clearing my doubt which I have in my routine OPD.
If you are from a particular subspecialty, I think sometimes attending a meeting where all pan of a specialty meeting, it can become a little monotonous.
Correct.
Because there are less chances of discussion from your topic.
Correct.
So I think it will be easy if you attend conferences like with focused topic.
Correct.
That will be much more
correct. So I think that is the way to go. I feel in the next decade, all these meetings will be focused to specific specialities like cornea, retina, glaucoma, uveitis.
Exactly. So the time has come now. We should think about that pediatric retina. The pediatric glaucoma. So this kind of subspecialty meetings are there, which will be much more focused discussion.
True. And people, I think, will be more free to ask questions also.
Exactly.
Because in a larger crowd, I would be a little reluctant to ask that question,
Correct.
which I would not be in a smaller crowd. So, one thing which I try to focus on is what I am doing after 6 p.m. And that is, I feel, a very significant part of my life, and I'm trying to focus a little more on that rather than what I'm doing in the day, because that is going to go on. So, what is your life beyond uveitis? What do you do, and how do you feel? How important is that in your life?
I think it's very important to have another dimension of your life. It's not about living the same life 365 days. It has to be a little different, and you have to challenge yourself, take new challenges and all. I can give you an example. When I turned 40, I started teaching myself photography. I told that, okay, I have to learn photography. Being a clinician and working in an institute, I don't have time to go for photography classes and all.
Sure.
So I tried a different method. After going home, I started seeing some videos, learning different methods of photo editing, which camera to, and then talking with the people and all.
You learned it online?
Online and talking with my friends and all.
Right.
Second thing, I was never a sports person, but I started just taking a new hobby, and I thought, okay, I'll just go into this. I started running. And now every day I run a 5 kilometer before I start my day by running for 5 kilometers. So I think this is very important to take these challenges, and it's main important to challenge yourself every time that yes, you can do it and let's do it someday.
Correct.
So it's not about the clinical work and all. These are definitely primary important, but you should have scope and time for other.
True. So I'm asking because previously a lot of doctors did not talk about things like burnout or getting tired at work. But nowadays what we are seeing, a lot of young surgeons, they are saying that at 40, 45, we'll be in a burnout stage, we'll make money till 45 and then we might plan to retire. So this entire concept of burnout is, I don't know why, but it is coming up eventually. What do you feel?
I feel one thing is that I don't know. My mama used to tell me that if you are doing something, always try to do with passion.
Correct.
Otherwise, you don't do
Very
it.
true.
So the problem is another problem. I feel if you are working too long, from morning 8 to night 8, then this definitely there will be burned out because it's a human body. It requires proper amount of rest and all. So I feel it's very important to relax also in between your work. Go for lunch break, take some time for yourself. It's not necessary that you have to engage in some academic discussion or some patient-related discussion with your colleague.
Correct.
You can just listen to some good music and have your lunch. So I think in between that breaks are important. You take coffee break. I always take coffee break with my fellows.
Yes.
So
I used to accompany.
yeah,
I remember.
exactly. So I find them so they will talk so different this thing. So they will teach you a different.
They might teach you Gen Z lingo also.
Exactly. Everything you learn from them. So many things you learn from your fellow and your colleagues. You know? I think these are important because we have stopped interacting with people in person.
Very true. Because of the phone.
Because of the phone and all. So that is most important. And we have actually given a very less time to ourselves. We don't have that so-called me time. So you need to have a me time for you. In whatever format you can go for a movie, you can go for anything. But I think you need to have sufficient me time.
Correct. So I think we should start talking about work-life balance more.
Yeah, definitely that is more important. But I feel work-life balance sometimes it's very difficult to balance. I suggest that you have some me time. In whatever format you try to have some time for me. You love to read a book. Try to read a book, and you can take it any times. I read a book 5 a.m. club, and that was a fantastic. That early morning you get up and 5 to 6, 1 hour you spend it for yourself. Don't think about your family. Don't think about anyone. The early morning 5 to 6 you go out, you go for a jog, you go for a run, you go for a walk, but you just enjoy that 1 hour and be with yourself. I think that's a fantastic concept.
Amazing. That's very interesting indeed. So my last question would be, I'm not calling you old, but if you have to give some pearl of wisdom or pearls of wisdom to the next generation who are planning to take ophthalmology or are in ophthalmology and who are planning to pursue ahead, how do you feel ophthalmology as a branch and what future do you foresee?
Yeah, I think it's a fantastic branch. It's like I always feel that this is the best branch I think you can have. You have a proper time for yourself. You can see patients. You can operate on patients. So there are so many ways you can. You are a surgeon. You are a clinician. So it's a fantastic branch, and I think future will be definitely promising for ophthalmology and equally challenging also. You have to see that many surgeries will be converted into the machines will start taking over. For example, you see the capsulorhexis.
Correct.
I remember we spent almost 6 to 8 months time practicing the rhexis.
True.
And the day I did first my femtosecond laser, I realized that in a fraction of second it's over.
Very true.
So the moment this will be much more sophisticated, much more affordable, I think the days are coming where the machines will do a lot of work for human. But having said that, also that definitely the challenges will remain because it's you are dealing with the most precious organ of humankind. So definitely there will be challenges and all. My tips for the ophthalmology student will be few things you have to understand that some knowledge or some wisdom will only come from the textbook or a printed material. I have seen people just going through the mobile or reading stuffs online These are the references definitely you should read and you should know about it, but the textbooks are some very crucial for learning during your education when you are doing post graduations or graduations, no? So the textbook, you go and you just while turning the pages, you come across something interesting photographs and you look, so you learn something additional.
A lot of people are not buying textbooks
Not
these
these
days.
days. I'm seeing that. So online, when you are searching like pseudo exfoliation glaucoma,
Sure.
it will take you only to pseudo exfoliation glaucoma. But in here, if you go towards that pseudo exfoliation glaucoma, before that you will see something else.
True.
So something else you may read, ended up reading something, gaining some knowledge. So this is very important, and I understand that YouTube, everything is a very useful media, and this really help and change the way we used to understand some complex scenario, complex pathophysiology. This helps, but you have to understand these are the secondary mode of education.
Correct.
Don't make them primary mode of education. So don't try to replace your textbook. Try to buy a textbook, read it regularly. Second thing is that you have to understand that the surgical skills you are seeing a surgeon who is experienced enough, and you try to actually be like him. So you have to understand that you need to give time to yourself.
Sure.
The entire post-graduation life, I see people are running after learning the cataract surgery, neglecting every other thing,
Correct.
neglecting the neuro-ophthalmology, neglecting the other subspecialties
Uveitis, for
of
example.
exactly.
Yeah.
So sometimes what happens, but because you will need a sufficient number of cases to perform before you become a qualified surgeon, or before you.
And that you eventually get in life, right?
Exactly. So that time you have to give it to yourselves. You have to be patient.
Correct.
And second thing is that, so as I told, that you need to unlearn some things, because it's very easy to learn new things, but it's very difficult to unlearn some old habits.
Sure.
And all. So be aware of it, what you have, and try to do that.
Thank you. Amazing, sir. I think it was a pleasure having you with us. Thank you so much for the pearls of wisdom, and hope to see you next time. Thank you.